Hey guys, Drifter here. Today I've got a video for you about the American healthcare system. And before we get too far into that, I want you to leave a comment down there below with your insurance horror story. Every single American that I've talked to has an absolute nightmare of a story about a time their insurance didn't cover something, they were out of network, or something crazy happened with their parents or a relative. So without even watching this video, I want you to go ahead and leave a comment about your insurance horror story, and I'm going to be reading all of them. So I basically absolutely hate health insurance companies. To the very core of my being do I despise them. I put them right up there with Nestle and their slave labor chocolate, right up there with oil companies polluting the planet while doing stupid marketing campaigns about green initiatives. They really are right up there with the worst of the worst, even without trying to be, because the entire incentive structure of our system is completely fucked, for lack of a better word. I try not to cuss on this channel, it hurts the monetization rates, and I need that money to pay my insanely high insurance bills, which I may have to change because my insurance company, Blue Cross Blue Shield of Texas, is entering into contract renegotiations with my hospital, UT Southwestern. So depending on how that goes, I might lose my chain of care. I might have to get new doctors. I might have to start going somewhere else, doing something else. And the reason for that is just the simple business contract negotiation. But when you're talking about healthcare, it shouldn't be as business oriented as care oriented, because what this does for me and many people like me is breaks our chain of care and makes us all go to new doctors and probably have to restart a whole bunch of stuff over again, which leads to worse health outcomes. So today's video is going to be roughly 5 or 6 topics about why I hate the American healthcare system, and more specifically, the insurance provider aspect of it, because I feel that our health insurance system is making the rest of the healthcare system significantly worse. And yes, obviously this is inspired by my issue with some kind of rare disease and my struggle against both hospitals and doctors and mostly insurance companies to get tests and treatment, and pretty much anything that's not a very profitable disease isn't treated well, which leads me to number 1. I believe that the American health insurance system leads to the insane hospital prices. There's a good analogy to be made between insurance and hospital prices and subsidized loans and college prices, with one exception. You tell kids go to college or you're going to be a loser, you have to get a degree, you're not going to get a real job, blah, blah, blah. And there's a little bit of scare factor there. But when we're talking about healthcare, when you're dying, it kind of almost doesn't matter what the price is to begin with. If I'm dying, if I've been shot and I know that I'm dying and I get to the hospital and the doctor says, sir, it's going to take $100 million to fix you. You're going to be in debt for the rest of your life. It's going to make sure whatever, sign and done. Now, there are some people that will price shop for hospitals, but one of the weird things about hospitals here is you don't actually know the prices of anything. The only people that know the prices of anything in the hospital are probably the insurance companies. Because what'll happen is you'll get a hospital bill for like $100,000 and your insurance will say, we covered like 90,000 of it, right? You have to pay the last 10,000 and you say, oh my God, I saved so much money. Whereas the rate that they paid probably wasn't the 90K rate. It was some lesser negotiated rate, sometimes even less than what you paid, depending on the insurance company and the system. But it just makes it look like you're saving a lot of money when it's not. But because of that unique interaction, that's one of the things that makes it okay for hospitals to just charge insane prices, because almost everybody has insurance. It's tied to your job. It's a reward for working. That's how you earn your health care, is you work for this economy. And if you don't have that, well, they can just hit them with the full cash price. It allows them to keep their prices very, very high, because this is a for-profit system. It's not a healthcare outcome-based system. It's a how much money can we make-based system. And one of the crazy things about that is it only benefits insanely wealthy people. The average citizen gets screwed by this, from the poor to the middle class to the upper class to the upper. You've really got to be rich. My estimation is that if you're worth under $10 million, you can instantly go broke at any moment due to health problems. The number 1 cause of bankruptcy in my country is people that can't afford their healthcare bills and can't get insurance to help afford them in any capacity. I could get sick tomorrow and undergo millions of dollars of treatment that would leave me in debt for the rest of my life. I could get sick with something relatively normal and get $1 million bill. And that's just brutal. It's like, if you're not worth $10 to $100 million, the system can break you almost instantly. I couldn't tell you how many people I know that sold their houses or remortgaged them more accurately, or sold their businesses or did crazy things just to try to pay hospital bills that the insurance wouldn't. Personally, I probably just wouldn't pay them, but that's me. And the second thing is, we'll talk about insurance here before we move into the broader complaints, is that I feel that the insurance companies are generally the ones providing your care from start to finish. The insurance companies largely determine what doctors are in network or what your percentages and copays are, so that limits most people don't have unlimited money to throw around, so they have to pick practical options. So just from the get-go, the insurance is kind of guiding you towards some care team. And then once you get there, the doctor will meet you for, if you're in a hospital, however much time the insurance allows, however much time the appointment covers. When it comes time for treatment, well, or not even that, testing, we have to see what testing the insurance covers. If it doesn't cover it, it's cash or you don't get it. Then we have to do treatment. We have to see what kind of treatment the insurance covers. And if it doesn't cover it for any arbitrary random reason in your 5,000 page contract, guess what? You get that insane cash price and you get screwed. You have to choose to either die or give up almost all of your money. It's so profoundly unethical to me. I mean, they have whole teams of people whose job it is to deny care and disapprove claims and basically shut down people that are spending too much. And I'll add a caveat, that's a real job and a real insurance company. You should have people to do that to help prevent fraud. Unfortunately, in healthcare, you shouldn't have people doing that in order to maximize the profit of the insurance company, which is where a lot of that happens. And it's insane because you have to sign these contracts to get health insurance, and nobody reads them or understands them. I maybe could, but they're so long, and I admit, I don't actually understand all of the ins and outs of my contracts and all the intricacies of the things that are and aren't covered, and most people don't. Most people show up at the hospital with an extreme problem and find out the hard way that it's not covered. So I've got two insurance nightmare examples here I'll throw in before we move on. One of them was with my wife. In nursing school, she was required to have health insurance because she's going to be working with bodily fluids and blood like that during her clinicals, right? This is a standard thing. And the insurance everywhere was too expensive, but her dad managed to find this really cheap insurance company that I forgot the name of, honestly. This would have been pre-Obamacare, so it was a little bit more Wild West. And I wish I'd remembered the name of this company, but it was cheap. And we knew that we shouldn't use it because we knew there would be some kind of strings attached. But ultimately, my wife got sick with something. I don't remember what it was, if it was the flu or a UTI or an infection or just something pretty basic, right? It got bad enough where I ultimately took her to the hospital and checked her into the ER to get some treatment. We tried to avoid that. I mean, she worked at the hospital, so I didn't exactly want to go back. And at the end of all of it, we got the bill and it was like thousands of dollars. We're college students. We don't have thousands of dollars. And I asked, what about the insurance? You know, we provided insurance. She has insurance. And they're like, yeah, but the insurance denied coverage for everything. And we're like, everything. We checked the hospital. This was a network. This particular type of problem, whatever it was, I can't remember now, was covered. Everything should have been good to go here. Well, it was, except this insurance company had the most bizarre policy I've ever heard of, and I swear to God this is real. It sounds totally made up, I know, but the policy was, among many odd stipulations, that the very first problem you have, regardless of what it is not covered. The very first time you check into the hospital on this insurance, if it's for the flu or if it's because you got hit by a bus, your first hospital visit is just flat out not covered at all. Coverage only starts on subsequent visits, follow-up visits, and things like that. I guess your second time being sick, this insurance had the first time is on you kind of policy to deal with, which I found to be insane. Neither of us even knew that. These are two college-educated people that know how to read contracts, and we didn't even know that was in there. Another good example is a friend of mine wanted to have a surgery. I'm going to keep their details very scant for privacy reasons, but a friend of mine needed a surgery to live. To just live. They have a sort of chronic problem, and it was closing one of the arteries around their heart, so that has to be reopened. Got to get a stent in it, right? Well, guess what? The insurance didn't cover that surgery. So my friend, who works a normal job and makes a roughly normal amount of income, their insurance company says they're not covering the surgery, and she can go die, I guess. Or the other option is you can pay the cash price for the surgery, only a few $100,000. That's the price to maybe live. And it's so screwed up. They had the doctor call the insurance company. They had the head of the hospital call the insurance company and argue for her. And they just didn't budge. They had to go to like some different hospital somewhere way else in some different network or something. And it's so frustrating. So very, very frustrating to deal with. One of the things that I've dealt with personally a lot is that our profit-driven system is really great at treating profitable diseases and common diseases. If you have diseases that require long-term care and management, like diabetes, COPD, heart problems, things like that, there are a million different systems in place to treat you and make your life a little bit better each step along the way. Of course, charging you each little step along the way, slowly bleeding. Most people drive their money if it's not covered by insurance. On top of that, the profitable diseases are ones that you can treat in mass. It's a profit-driven system. So people that have extremely common diseases like, we'll just say like heart problems, or they've got vision problems, or we use diabetes. That's by far the most common one in the United States. These are problems for which there are excellent diagnostic tools, excellent treatments, excellent ways to monitor, alternatives. But if you have a disease or a problem that's not in, I will say, as little as maybe the top 10 or top 15 common and profitable, the quality of treatment, the level of education, the amount of insurance coverage, basically everything gets really, really minimal. The further you get away from normal, the less the system works for you. And I understand that that has to be true to some extent, because if you've got a rare disease, you're going to need to see a rare doctor and it's going to be a little harder. And I get that. But in our system, it's way harder. Okay. For example, I have an endocrine issue. I don't make testosterone, and a few other of my things are very out of balance. We'll skip all that. But I went to go see an endocrinologist for treatment. Endocrinologists in the United States mostly deal with diabetes and very little of anything else. So when I went to go see them for treatment, the doctor was very confused why I was there if I didn't have diabetes, and we talked about the testosterone problems. And like, oh, just go to a clinic and get the injections, it'll be fine. I'm like, but doctor, there's other problems here. It's like, yeah, that's not really my problem. We mostly do diabetes here. And I'm like, yeah, but this is an endocrinology clinic. I talked to your staff and they said they would treat this kind of problem. And the doctor's like, no, we just do diabetes. You're going to have to go somewhere else. So I eventually had to find a specialty endocrinologist, and one that will probably no longer be covered by my insurance, in order to get any kind of treatment at all. And things like that are just very frustrating. Two more topics left here at the end. We'll go with number 4 on the big rants. It's that this sounds like a lot of whining and an advocacy for socialized medicine, and it probably is. And for those of you that just absolutely hate socialized medicine, I 100% understand why. There are real valid concerns there we could get into in a different video. But I did want to point out a very disturbing fact. We spend more money on healthcare, both in total and per capita, than almost anyone else in the world. And by we, I don't mean me, the American worker citizen paying my insurance bill and whatever other ungodly bills they come up with. What I mean is we, the American taxpayer, because the United States government, Medicaid, Medicare, subsidizing all these different things, puts more money into that system per capita than countries that have straight up free healthcare. And they put more money in total than a variety of countries that have free healthcare. So we're spending more per citizen on healthcare, and we're still getting bad results from it. And our healthcare is still the most expensive in the world. So like, it's insane. It's because what we're spending on people that have Medicare and Medicaid is like 10 or 20 times more than what anybody else spends for any system in the world, because they have to pay these private cost bills that are insanely high. So we're doing all of this insane tax money spending. We still have the highest medical prices and some of the worst results from it, which leads me to number 5. We have some of the worst results mostly because our entire society is not proactive about health at all. There is very little preventative medicine in the United States. There's very little helpful exercise. Every doctor will tell you to lose weight and exercise in some sort of smart-ass kind of way that'll make you not want to do it, but very little actual support for that. Even physical therapy, once you can walk, you're out of physical therapy. It's done. You got to go do something else. So we're not even remotely proactive about health. A lot of us work sedentary jobs. We live in very highly polluted environments. Our food is very unhealthy, filled with preservatives and high fructose corn syrup and almost everything here in the country. It's not very good for us. And on top of all of that, the people actually getting the Medicare right now are boomers who created all of these problems. Drives me absolutely mad. And they all want pills. So my wife worked at nursing homes. She worked at hospitals. I've had to take care of a couple of people's elderly parents. And I don't know what it is about that generation, but they believe in the miracle of science more than any other group of people I've ever heard or seen in my life. And they believe there's just a pill to fix anything. If a boomer has a problem, there's got to be a pill for it. You know, all this stuff about physical therapy and diet and exercise, blah, nope, just give me the pills. Fix me with the pills, bro. That's all it is. I'm rambling. I'm ranting. I'm mad. I'm just really genuinely tired of fighting this. Like, I have something wrong with me. I'm still trying to figure out exactly what. And every step along the way, I feel that I'm fighting against my insurance company. I'm fighting against the management system at the hospital. I'm fighting against some, not all, I have some great doctors. I have run into some of them that like, oh man, this is a guy with a more advanced problem. I don't have time for that. This doesn't make me money. We're going to ship him somewhere else. So I have to fight against stuff like that. It can be very, very, very taxing. And I have some friends, the one I mentioned with the heart surgery thing, planning to leave the United States and maybe immigrate somewhere else just so they can get medical treatment and not die. They don't want to leave the country. They just have to get treatment somehow, some way, somewhere without just literally being in debt for the rest of their lives. And oh, one more thing. I'm going to add one more thing. This is a pet peeve. It's really more about doctors' offices in general and less about the healthcare system. I have begun to despise doctors that use apps because this is what happens. I call in on the phone to make an appointment and they'll tell me that I need to go fill out the online tool. So I'll go fill out the little online form. And all that does is then they call me for the appointment and I do that on the phone. Okay, totally useful step right there. I'll take some information on the phone and then they'll send me an email with all this like link to their clinic and stuff to fill out, and I fill it out. That's all standard. And then I'll get a second email about the doctor doing telehealth through some specific app that they've signed up for, partnered with or something. So I'll make an account with the app. Oh, guess what? This app doesn't have a desktop version. It's mobile only. Okay, that's really great. And then I have to put the same information in again. And then if for any reason I do go see the doctor, if I need more than just the telehealth, I'll go there and then get paperwork to fill out the same stuff again. And it's just, for a guy with bad hands, it drives me crazy. So that's kind of the end of my rant video. I don't have a solution for you here. I just wanted to let you know that from the very bottom of my heart, I hate insurance companies. I hate our healthcare system. I hate everything about it. I've moved into more of a burn it to the ground and start from scratch kind of phase. I don't even know if it can be reformed. It's so effed up. And I can't wait to read all of your screwed up comments about the times that insurance has screwed you or other family members. All right, guys, that's all for this very negative video. If you enjoyed it somehow, don't forget to like, favorite, and subscribe. Drifter out.